Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. There's 8 points I would like to cover in this video. First, I will go over a quick view. I'll give you a quick view or overview of normal healing cycle. Second, I will explain what is fascia or myofascial system. Third, I will go over the different function of the fascia system. Fourth, I will explain or present the different layers of the fascia in our body related to myofascia, which is the muscular fascia system. Fifth, I will go over the symptoms of the fascia restriction. Sixth, I will explain who patient could possibly have fascia restrictions. Seven, I'll present the current treatment for myofascial restrictions and what the research says about those treatments that been used in current medical field to treat the fascia. Lastly, the 8th point, I will go over the best solution for myofascial release. Our body has to go through 3 stages in order to heal. First stage, for example, I will just use external paper cut for visualization, but the same process happens internally from poor posture, poor body mechanic, accident, trauma, so on. So first stage is inflammation. So as you see in the image, with inflammation, you will have like blood start rush to that area, increased temperature, decreased function, increased pain, swelling, redness. Second stage is the proliferation stage. That's when our body starts to build a scar tissue. So if our body does not build a scar tissue, the cut is open wound and susceptible for infection. So scar tissue is essential for our survival. At the same time, during the proliferation, there's a cascade of events, including fascia restrictions, muscle spasm, trigger points. So in this video, actually, I will dissect the fascia part of the healing cycle. In the previous video, I went over the whole healing cycle and the best approach to address chronic conditions. And the second video, I went over the fibrosis and we spent a lot of time to explain what is fibrosis, how we treat it, and the current study on fibrosis. But in this video, I will just focus on the fascia restriction. In the last stage of the healing cycle is called maturation. During this stage, our body starts to release the scar tissue and break down the scar tissue, and that could take days, weeks, or months, or years, and that's the end of the healing cycle. But in a lot of patients, I see it in my practice, they usually not in the maturation stage. Otherwise, I will not see them because they already healed. So usually, patient is just stuck in inflammation, proliferation stage, or they actually going back and forth between inflammation and proliferation stage. And I went over in the first video how we treat the entire system and how to address the whole healing cycle. But in this video, we'll just focus on the fascia system only. So what is fascia? Fascia is a connective tissue, layers and wraps that support and surround all organs, bones, muscles, nerves, and blood vessels. The dominant cell for the myofascial system or the fascia system is the fibroblasts. And I went over the fibroblasts in the fibrosis or the scar tissue video. You can go back to that video to watch to learn more about the fibroblast or fibrosis. What is the function of the fascia? First is separates. So separates individual muscles or separates muscles from bone, from other organs. Second function is supports. So it gives the body its shape and it maintains vital organs in correct position. Third, protects. It help the body resist mechanical stress internally and externally. So let's visualize the fascia system. So fascia is very thin layer that under the skin. This is a superficial fascia that's wrapping the entire body. It's like a Spider-Man suit. So that layer encompasses the entire body. That's the superficial layer. But think about the fascia, it's a different layers. It's similar to, you go into a grocery store and you want to buy vegetables and fruits, for example, tomato, orange, tangerines, potato, so on. So what he did is putting each individual produce in one bag. So you put the potato in one bag, the tomato in one bag, the orange in another bag to separate them. That's what the fascia does. But you decided to put all the vegetables in one bag. So you took each vegetable and put it on each individual bag, and then you put the entire system of the vegetables in another bag, and you decided to put two bags, one that including all the vegetables, another one all the fruit you bought in another big bag. So the big bag is the superficial layer that trapping the entire system, and the individual bag that trapping vegetables by itself or fruit by itself, that's another layer. And third layer is the layer that bag that's wrapping each individual fruit or vegetables like tomato or potato. So layers of the fascia. Okay, so a superficial layer. The superficial layer separates the skin from the musculoskeletal system, allowing normal sliding or gliding the muscles in a different layers that can slide over one another. That's a superficial layer. That's like the Spider-Man suit wrapping the entire body. Deep layers. So deep layers, it's subcategorized to 4 layers. First layer is the apparatic fascia layer, and that apparatic fascia is around a group of muscles. Like the example I just gave you, we put all the vegetables, the potato, tomato, and so on in one bag. That's the apparatic fascia that's wrapping a group of muscles. So the apparatic fascia consists of 2 to 3 layers of collagen fibers. It's a sheet tendon that expands with the movement. Dominant cells is fibroblasts. The function is to connect the muscle with the parts of the movers for the movements. Example of the aponeurosis or the apparatic fascia is the palm aponeurosis, the plantar aponeurosis in the feet, the thoracic lumbar aponeurosis, and so on. The second deep layer is the epimysium fascia. This layer surrounding the entire muscle. So the apparatic fascia is a bag that surrounds a group of muscles like vegetables. You put all your vegetable in one bag, but you decide to put each individual vegetable like tomato, you put all your tomato in another bag. So the epimysium is the fascia layer that surrounds entire one muscle, one layer of the muscle. So it consists of several layers. Each of those layers of the fascia is actually consists of several layers, sub-layers, but it's that group that surrounded the entire muscle. It's called epimysium fascia. Fascia is actually a layer that bundle inside the muscle. So the muscle, you have the muscle surrounded on one layer, it's called epimysium, and inside that muscle there is a bundles of fibers that bundles connect surrounded by the epimysium layer. The last layer is the endomysium fascial layer, which actually wrap individual fiber, each fiber. So the endomysium wrap each individual fiber. The premiysium bundle several fibers, and you can see that in the image. And the epimysium actually surround the entire muscle, and the apparatic fascia actually surround a group of muscles. So what cause fascial restrictions? Okay, so we can get fascial restriction from trauma, accident, poor posture, poor body mechanics, inflammation, surgery, infection, dental work, or any structural deformity like leg length discrepancy or pelvic rotation. Those are some of the causes of fascial restrictions. So symptoms could include headache. Some patient experience like a band feeling on the head. Could patient experience symptoms of numbness, tingling, band-like pressure or pain throughout the body. Some patients say like it's a round rab or like a circle or something like that. Joint pain, also decreased joint range of motion, decreased flexibility, joint stiffness, muscle weaknesses, and also nerve-like symptoms that could happen from the fascial system is actually compressing on the other layer. So just for example, let's think about the fascia, the superficial fascia, as my t-shirt. So I don't have any fascial restrictions here. So when you have fascial restriction, it's like you're wearing a t-shirt 2 to 3 sizes too small. So if my shirt is very tight and my fascia is very tight and try to elevate my arm, that will prevent me from movement. So that shrinking or like restriction on the fascia system, it's actually compressed and restricted the movement of the muscle underneath it. And also, if that restriction compressing on nerve or artery, or it could cause numbness, tingling, some like dull pain. Which patient has fascial restrictions? Everybody. So it's with any injury, usually musculoskeletal injury, usually patient has some degree of fascial restrictions. It could be the main source of the problem, or it could be secondary, as other sources could be fibrosis, trigger point, inflammation, muscle spasm, and I went over the fibrosis in the previous video. You can watch that. Everybody that could experience fascial restriction, like from joint pain, sciatica, arthritis, headaches, back pain, carpal tunnel syndrome, tendonitis, bursitis, so on. The list is very long list. The current treatment for myofascial restrictions or fascia release, one of them is massage. And let's go over some of the studies on massage. Actually, I will go over one study, systematic review, but there's a lot more studies that has a similar finding and confirming the same finding that massage has a low effect of improving function. So this study, they looked at the massage therapy for neck and shoulder pain. This is a systematic review and meta-analysis. They reviewed 12 randomized controlled trials that those trials met the criteria of that study. And based on evaluating those 12 studies, conclusion is no evidence suggests that massage therapy was effective in improving functional status to the neck and the shoulder pain. So massage is not very effective. So if even they say they do fascia release, I'm not really sure about that. So massage is not effective. There's more studies. If you want to get some links for those studies, just contact me. I will send you those links. Second study about self-myofascial release, and this is a systematic review. They looked at several studies to evaluate the self-myofascial release, is it working or not. So their conclusion is there is conflicting evidence whether self-massage release can improve flexibility long-term. So there is no long-term, cannot be found, or you could not come to the conclusion there's a long-term effect for self-myofascial release. So what is a solution? So I had this problem because I used to suffer from chronic pain and fatigue, and I had a lot of fascia restrictions. And the problem with current model, they use their hands, that it's hard to evaluate it properly with the hand, and also it's hard to release it with the hand. So I went over 100 prototypes and design to come with the final design that to release fascial restriction. So I came up with this instrument. This is to release deep fascial restrictions, to release the epimysin, the premiysin, and the endomysin. And I have two other instruments that I use to release the superficial fascia and the apparatic fascia. And it's very easy to use. It's a very ergonomically designed, and the training is provided through ASTR classes to learn how to use this instrument. And these instruments only available through ASTR Institute with the education classes. So what the solution for fascial restrictions? So when we look back to the healing cycle that I went over in the beginning of the video, fascial restriction is one element of the problem. So when we treat patient, we cannot only think it's a fascia only. So when you look at the healing cycle, there's inflammation, and we need to know how to evaluate inflammation. I will go over the inflammation in the future video. Also, there's a fibrosis, a scar tissue. We need to know how to evaluate a scar tissue and treat it. And there's a trigger point, there's muscle spasm. So for practitioners to be able to treat patient properly, they need to know how to evaluate those elements and how to treat it efficiently. And in future video, I will go over how we can do that through the best practice. Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video within the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class, so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.